Okay, thank you. Welcome everyone, welcome to our public governing body. I'm just going to ask, because it's very difficult when we do this on Teams to understand who is present, so I'm just going to go through, can I ask all of the governing body members just to put a Y in the meeting chat, just for the letter Y, not a question, just so that I know that you are here and can hear me, so we can continue as quorate. And while you are doing that, I would just like to welcome members of the public. This is our public governing body meeting for December. Thank you for joining us. We've got a number of items on the agenda, and I'm sure a number of you will be joining in order to hear item 7.1, which is where we are considering proposals around the Tinmath Doris area. Just to try and help you get the most from this, we've tried to make the technology as user-friendly as possible. There may be a slight delay in passing from one person's video to another, as we are all in our own individual homes or buildings, and our technical support, Steve, will be needing to identify who the person is speaking, but hopefully you should at least hear everything that is going on. And the slides and the films that you'll be seeing during the course of this morning should come up on the screen. Hopefully you've had access to the governing body papers. I'd just like to let you know there has been a last-minute addition to that, and that is because the Devon County Council Health Overview Scrutiny Committee met with us on Monday and have since then issued a letter regarding the consultation. And that is now available via our website as an addition to the governing body papers. But it is last minute because we've only recently received that, so that went available this morning. So please do take the opportunity to have access to that. Many of you will have comments and questions that you will like and want to raise, and I will go through this again just before item 7.1, but just to understand how we're going to do this, those of you who are listening in, you will see sort of speech bubbles with a question mark on them on your screens, and if you click on that, that gives you an opportunity to pose a question or a comment. Now, myself and my colleagues on the governing body won't necessarily be able to see that, and what we've asked is our communications team will be monitoring that, and we'll try and pass on to the governing body as many of the comments and questions and emerging themes as we possibly can. We won't necessarily manage to get through all of them, but we will do our best to cover as many as possible. In order for us to get through the business that we need to and make sure that the governing body is in the best position to make the decisions it needs, I won't keep interrupting proceedings every time a question or a comment comes up, and there will be two opportunities for questions from you in the public to be played into our discussions during item 7.1, and when we get there I'll specify when those are. But in the meantime, I hope this is a useful time for you, a chance for you to hear some of the things that we are doing, as well as the plans for Coastal in our role in commissioning health services for the whole of the population of Devon. The first thing to do is the welcome to the public. Welcome to governing body members. I do have apologies from Ruth Harrell and Caroline Diamond, and also Penny Harris is unable to join us this afternoon. We don't have any written questions from the public, but as I said a moment ago, anything that does come through subsequently, I will make sure that we pick up. And before we start on the register of interest, we normally start with a story from a patient or a user of services, because it's important that when we meet as a governing body, we remember who we are doing this for and who we're making decisions for the benefit of, and to start off by hearing someone's experience, whether that be good or bad, of services here in Devon is a really good way to get us focused. And I thought, given the topics that we are going to be focusing on today, it would be really useful to hear what has been happening over the last few years in Tinmath, and it is the same video. If you've been to our public consultations, you will have seen that. So, so Steve, if we can start with that video, please.
My name is Matthew Fox. I'm a GP in Dawlish. I've been a GP for 20 years. I live in Tinmath, and I've been supporting the patients at Tinmath and Dawlish for 20 years. I spend 1 day a week working for Torbay Hospital as part of their intermediate care team. Every weekday morning, Monday to Friday, we sit down as a group of professionals. So that's a GP, one of the GPs from the local practices. That's our community health team. It involves our occupational therapists, our physios, our community nurses, district nurses, a mental health team as well, and our voluntary sector. Our team isn't just statutory NHS services. Having the voluntary sector embedded in the same room at the same time gives us the potential to really support our whole community.
I'm the intermediate care and therapy lead here at Coastal, and we at the team here work towards ensuring that people in the community are kept safe and at home on a day-to-day basis. My role is very much to support the team in delivering that. So the value of having us all in one room at the same time is really helpful because it's beneficial to bring up not only the people that we discuss as part of intermediate care or in the community, is about the fact that you can bring anyone to the room, and because you've got a wealth of information there and you've got experts in all those different fields, all of us together are able to then figure out the best plan for that patient and on that day.
I'm the Community Services Manager for the Coastal Locality, so that means I'm responsible for the health and the social care teams that work out in the community to support people in their own homes staying as independent as possible. Enabling cross-working between voluntary sector, health, social care and primary care is absolutely vital in us being able to progress our services to the next level.
I'm the Community Nurse Manager for the Coastal Locality. My job involves overseeing the work of the community nurses and also the intermediate care nurses and the nurses that work in long-term conditions. So the aim is to have an oversight over the coastal locality of patient need and matching the right nurse to the right patient.
I'm an occupational therapist in coastal intermediate care, and my job is to go out on urgent visits to address immediate crises and work out solutions. That might be equipment, that might be care, supporting relatives and coming back to feeding back to the rest of the team. So here in Coastal we have exceptionally strong links with all of the service providers, so not only our immediate colleagues, the nurses, physios, GPs, local social care assessors and social workers, but also we have strong links with local care teams, especially rapid response carers.
Traditionally, people have thought of medicine being you go and see your GP, if you're poorly you go to hospital, when you are better you go back home again. And the only place you could have your care was in a traditional hospital. The world has really moved on, and there's really good evidence that actually if you can support people in their own home, you can actually support more patients than you could just in a traditional hospital ward. So for us, integrated care is actually how do we bring all the parts of our system together to work more powerfully on behalf of our patients.
People in Tinmath and Dawlish are being urged to have their say about the shape of future health and care services once a new £8 million health and wellbeing centre is built in the heart of Tinmath. Torbay and South Devon NHS Foundation Trust is planning to build a state-of-the-art new health facility so that GP services, health and care and voluntary sector services can be brought together under one roof in the centre of town, providing seamless care for patients and carers.
To have a centre that is actually on the level in town, a designed building that we've all been involved with, will really enable us to join up the relationships and the understanding of each other's roles and the pressures on the different areas will really help that working in terms of how we link together to support clients going forward.
The Health and Wellbeing Centre would obviously be a new purpose-built building, so the room size would be government specified, there would be excellent access and good access for disabled people, which would be a considerable change to what we have now. I have been involved in the planning of this building for the last 4 years. We have had many meetings to discuss how it should be built, and we think the building we've come up with will provide everything that is needed to enable many multidisciplinary teams to work in the same building. So we'll be able to talk to social workers, occupational therapists, physiotherapists, pharmacists, and I think that will hugely improve the communication for all the healthcare in Tinmath to the benefit of both patients and staff.
I think they're really
looks like we have stretched the technology to its capacity. We got virtually through to the end of that. Don't worry, Steve. I think we were just on the last minute or so of that, but we certainly got the general message coming through there. And apologies if, like me, when you were watching it, it was slightly stuttery. But I think it gives a flavour of the sort of ways we opened our public consultations meetings, and a flavour of not what just what the GPs or the therapists or the nurses felt, but bringing them all together as their views as to what they were able to do. What is the opportunity and the experience so far within that coastal area? And we will revisit that. I won't take any questions at the moment on that, because we'll revisit that when we are onto the item particularly focusing around Tinmath. The next point is just to double check with conflicts of interest. So I will ask again via the chat part to let me know if there are any adjustments or additions that need to be made to the conflicts of interest that are within our papers. And nothing is coming up from you guys. Thank you very much. And then just to ask whether there are any specific conflicts of interest that you need to alert us to that are pertinent to any of our agenda items. Okay. And then can I ask governing body members during the course of this meeting, if at all possible, keep your cameras on, because then when we do move to you, when you have a question to raise, the only thing you need to worry about is making sure that you're not on mute. And it is helpful when you're not speaking to be on mute, and just reduces the risk of any sort of feedback or background noise and makes it easier for people to hear and follow. Thank you very much. We've then got the minutes of the last meeting, and I will take them through by page for accuracy, and they are for the meeting from the 26th of November. So put your raise your attention to me either by the chat or just talking to me if you have an issue with either pages 1 or 2, 3 or 4, 5 or 6, 7 or 8, 9 and 10. Okay, we will take those as an accurate record of our governing body from last month. On the action log, we only have one action. Andrew, I'll just ask you for an update on this. This was raised, I think, Sheila, you raised this, that when we have the annual staff survey from NHS England, they have you were concerned they had quite a binary approach to people's ability to specify their gender. Andrew, it looks like you have written to those involved. It's in progress at the moment. Any update on that?
Thank you, Chair. We have written to PICA, who obviously organised the annual staff survey, and we're just awaiting their response. So when I get their response, I will make sure that all governing body members receive that.
Okay. I think we can close that action because we've done our part, but it will be useful for you to report back to us, and we can do that offline just by email, just to confirm the outcome from that. Thanks very much. Next item is the Chair's report, and that's verbal. So I'm going to use this as an opportunity to say a few words, if I may, before handing on to Simon for the Accountable Officer's report. So this is our last GB of the year, our last governing body of the year, and I'm aware the key issue of today is around Tinmath. But before we get to that, I want to use this Chair's report to reflect, to say thank you, and to look forward. So first of all, to reflect, I don't know if anyone saw the recent Panorama programme on the vaccination process in Oxford, as well as being really insightful into that process. It brought back so many memories of different phases of this of this pandemic that we've been through, and touched quite a few emotions as I sat and went through it. And I was just reflecting on everything that we've been through as a society and as a health system and as an organisation in the last few months. March the 23rd, 2020 in this country will be a historic moment when the country went into lockdown, where everyone, not just our organisation, but in primary care and in lots of other areas in our health system, rapidly shifted to virtual working. Where we emptied our wards because we didn't know what was coming over the hill. We had to be prepared. We got all of primary care operating in a total triage way and working virtually, and got the technology available for them to do it. One of the greatest challenges very early on was PPE and concern about whether we would have enough PPE for our staff, and the CCG was key in making sure that we could do that. Our care homes were an area of concern, and members of the CCG rolled up their sleeves and got directly involved in care home work, but also we supported the local authority and we set up the care home webinars to try and support them as best we could. We had the primary care webinars, and Jo was central in making sure that that happened, because so much was being asked of them, so much information, so much rapid change, that we helped them through that. And then came the summer when we had to get everything back up and running again. All those services that we paused, all those people who needed their urgent operations or who needed to be able to get in and see their doctor. And the team worked tirelessly to do that. And then the second wave came, and the second wave wasn't just about COVID, it was about COVID and winter preparation and routine elective care and all of the extra things that we had in the first time turned off, and the teams had to do both. And we had to get a Nightingale hospital open, ready for what that second wave might bring. And now we are faced with something that is hugely positive, but is a massive, which is the vaccination programme. And the teams have worked both within the CCG and within a primary care and the hospitals extensively to get that started. But the start is just, well, the start is just the start. There is much more still to be done. So I want to say thank you. Thank you to all governing body members. You've not stopped caring, you've not stopped supporting, you've not stopped working hard through all of this. And I know from conversations with my executive colleagues and with other members of the team that actually your support and the way you have conducted yourselves has been massively helpful in the CCG's efforts. To all the staff in the CCG, including the executives, thank you, because you've demonstrated just what you're capable of. Our staff awards demonstrated that. It wasn't just COVID, it was lots of really good pieces of work throughout the year, and that was an amazing celebration to be able to do that. Thank you to the staff for adopting a new way of working so well, and thank you also for the way that you have supported and cared for each other through this, because it's not just been a massive undertaking for work. The personal impact of isolation and coronavirus has been the same for you as it has been for anyone else, and you've supported each other in going through that. Thank you to all of the health and care staff beyond the CCG, all of the things I've mentioned and going beyond, and the risks that you've taken for your patients and the way that you've worked over and above. Well, that phrase above and beyond has been used a lot, and it probably applies to everyone in the front line who's been involved in this. And then thank you to our public. We've had low levels of coronavirus in this county. What we feared would come over the hill never did materialise to that extent, certainly so far. And that is in no small part down to the way you have followed those simple things in trying to keep yourselves and your families and your population and your communities safe. So thank you. So a year comes to an end, and in many ways it's one to forget, but in many ways it's one to remember and to build on and to learn from. And so we look forward to a year that will start as the last one ended, with a virus still present and the challenges it brings still part of our lives and our work. With a vaccine which gives us the hope of return to normality, but a massive ask for our staff and for our organisations. With a huge challenge for the NHS to rebuild and restore services and to catch up on lost time. So what a year. Thank you for being part of it, and thank you for your part in it and for being with us as we go through it. And I do look forward to working with you all over the next year. Simon, Accountable Officer.
Thanks, Paul. A bit of feedback. Okay, thank you. So I'd echo everything you've said, Paul. As you were speaking, I was recalling the phone call that I received on a Sunday evening from Sonia, who was on call, and she told me that we'd had an outbreak or two or more cases in a GP practice in Torquay, and at that point, I think memory serves me right, we had less than 100 cases in the country, and nobody had really knew what to do. We went in on a Monday morning to Pomona House, which is our Torquay office, and this was before social distancing. We called the teams together, and I asked for a couple of admin staff, a pharmacist, 2 nurses and a GP to help the practice deal with the patients that were being displaced temporarily from the GP practice. And within 10 minutes, people were on their way down to actually help and support. And I think that continued throughout the process. So as things got more difficult and bigger, our provider colleagues, and I know some of them are on the call, also did that. So support into care homes, support to each other, and again continued support to the public. So the year has been very difficult, but what it's done is brought the best out of I think the health service, public services, and the people of the United Kingdom. So in terms of my written report, there's only one item I wanted to draw out, which is item 6, and just to say that I'm incredibly proud that we've retained our Green Star rating, which is the highest rating we can have for engagement with the population. I think it's quite pertinent for me to bring that up today, given the main emphasis of the meeting, but we've managed to retain the ability to engage with our public because we've been quite innovative last year in terms of setting up a digital platform called Virtual Voices through Andrew Millwood and his team. And that's been able to be built upon in terms of how we can still continue to reach out to people, take their views on the health service and the way our services are running, good and bad, and be able to make sure that feeds into our decision making. So very, very proud to lead an organisation that's been able to continue to do that throughout what's been, the most difficult period and year. But I'm happy to take any questions from governing body.
Any questions or comments for Simon on his AO report? Judy.
Sorry, I'm struggling with the different look of the thing. Thank you very much, Simon, and actually also Paul. I think you've both reflected very well how impressive staff in the NHS have been in the last year. May I just ask one question on item 4, Simon? The integrated care system and this national engagement process, which completes fairly soon. I'm just wondering when we as a CCG will have a chance to, I suppose, approve a document. I know we've had some informal discussions, or to have a look at a formal response from us into the national engagement process.
So that may be a question for, am I still on mute? No, so that may be a question for Paul, but I think our plan is to speak to you all to make sure that we get a well-rounded view. So we've got to the 8th of January, so I know it's not long, and I know Susie, as independent chair of the STP, is also collecting a system view. But Paul, I think I'm right in saying that you and I had discussed that we were going to collect the governing body's views and put a collective CCG response in. That's right, Paul, isn't it?
Yeah, absolutely. That's what we're going to do. Although the timings don't quite work, as far as the actual submission, we will also make sure that it comes through our formal governance processes. So there'll be opportunities for you as individuals to contribute, and Simon and I will make sure that we represent those. But there, as a formal governance process, we will also bring this to our governing body. It'll be post submission, but it's still something that all the organisations will need to sign off and take ownership of at board level, and we'll make sure that we do that.
Thank you.
Any other questions or comments for Simon?
So you got one from John and one from Simon Kerr.
Oh, sorry, Simon Kerr.
I'm not on mute. Shall I go, Simon?
Yes, go on, John, you go first, and then Simon can find his mute button.
No, Simon, I want to go. So it was really on the item around ICSs and also the engagement. So congratulations to Andrew Millwood and the team around the virtual voices. And as we move towards an ICS in April of next year, I think we're still going to be under the challenge of COVID. So the freedoms may not be as available as we'd like. Are there any plans to make a digital access to engagement available to localities the same way as it's been available to the SDP and the CCG, so that we in our localities can engage as effectively with our local people as we have as a Devon system?
So John, I think actually it's available already to localities to do those pieces of work. Just needs the request to come in to to Nelly and the team. Okay. We can do that right now.
Great, lovely, thank you.
All right, Simon Kerr.
Thanks. So yeah, I would say we've had a lot of help in our practice. John setting up a virtual patient panel just for our practice from the CCG comms team. So thank you for that. May I just say a formal thank you on behalf of primary care general practice to Paul, particularly, and Joe, for all the help that they have given us to make huge transformational changes through the whole COVID period. I think I don't speak for all of primary care, but I as a practicing GP, we've had a huge support from those individuals and from the whole executive team to make our lives much easier in general practice. My question really, though, for Simon is about Brexit. I just wonder whether you mentioned it in item 8 of your report, whether we could see more of the information about the measures that we're putting in place to mitigate any potential issues that might arise, and if you could possibly circulate that to us, or maybe talk about it now, but circulate that to us outside the meeting, maybe.
Yeah, more than happy to share. I'll bring Sonia in to talk about the detail. Sonia?
No, I think you're still struggling to sort out your mute button, aren't you?
No, she's off now. Sonia?
There.
Simon, we will circulate. We will circulate that. So obviously plans have been put in place. So they're mainly nationally driven around expectations. So things like medicines, continuation, etc. So what we're doing currently is making sure that we are stock taking to just to make sure that we've got everything we need in place as nationally prescribed. Obviously, as you know as well as I do, there are ongoing negotiations that could make a significant difference, and it's very close to the wire. But we have a regular check-in to make sure that we're complying with everything that we can, given the uncertainty. But we'll make sure we circulate that.
My button seems to be working now. Sorry about that. I don't know what was going on. So just in terms of the process, so obviously we were given some planning assumptions. They're nationally led. We had the opportunity, all of the providers and including ourselves, on behalf of non-NHS providers and contracts we hold, to take a temperature check like we did last year against the same planning areas as we did last year. What I think is important to say is the preparations that were put in place for earlier this year still stand. So the additional logistics, the additional transportation, etc., were contracts that were let for a long period of time. So a lot of the work that we've been doing so far has been looking at previous preparations, what still applies, what's changed. But as Simon says, these are very live conversations that are nationally led and of course internationally as part of the negotiations that are underway. Important though is that we are ready, and of course our preparations in terms of response to things like COVID and winter also stand us in good stead to respond to other challenges for our resilience, which may or may not arise through this.
Thank you very much, Jo. Charlotte, you've got a question.
Thanks.
Sorry, Sonia, I just called you Jo. I'm very sorry. I was already moving on to mentioning Charlotte's name and got yours wrong. Apologies, Charlotte.
Thanks, Chair. Simon, I really welcome the update around the domestic violence lead post and the work that's going on there. And it was just to ask really if we could have, as it emerges, some further information about the impact of that work and the programme, which I think is really, really valuable.
Yeah, of course, Charlotte, and I think it might be, I know it's a very difficult subject with a vulnerable group, but I've often thought that a patient story, a person story around this sort of area would be incredibly powerful. It's just about finding the right story, isn't it? But yeah, more than happy to do that.
Thank you, and thanks, Simon. I've not got any more comments or questions coming through. I'm aware that we should start the item 7.1 at the allotted time, which is 3:20. In order to, I would rather take time off at the end of the day rather than introduce it in the middle. So I wonder whether people are happy if we move to item 7.2 in the meantime. And Andrew, do you want to take us through the engagement highlights? You're on mute at the moment.
Thank you, Chair. Yes, I'll happily do that. So I was keen, Simon said, I'm really pleased that for the second year, the CCG actually working on behalf of the system, because a lot of the work we did was system focused rather than just purely CCG work. So on behalf of the system, we gained the Green Star rating, which is labelled as outstanding as one of the 4 categories. For me, I put a small paper together with the team just to highlight some of the work that we've been doing. So we've obviously done some engagement around the long-term plan that was last year, where we engaged with quite a number of members of the public and with patients around what was important for Devon. We obviously came up with the idea of, with some NHS funding and support, the Virtual Voices panel, which has been absolutely fantastic. It gives us a great opportunity to hear the voices from local people about what's important and also to test ideas with them. So we used the panel quite actively during the first wave of coronavirus. Because we were faced with lots of local people not attending appointments or coming into hospital, and we wanted to really truly understand what the barriers were, which of course helped us with some campaigns to actively encourage people with reassurance to come into hospital, continue with their appointments, etc., etc. We've also done some quite sensitive work with some diverse groups. And also with Dame Susie, the chair of the system, also did some work around the ethical framework, which was put in place as part of the coronavirus response. So again, it just gave us a chance to ask local people about their views, ideas and thoughts about things that were important to their health service. And for me, it is something that we'll actively work on going forward. we're really keen to involve local communities a lot more than we do. So we have done some work in Holsworthy and in other parts of Devon, but clearly they're just parts of Devon. And for me, I want to do a lot more to engage with local people, because when you do, it brings massive benefits to the health service. We learn a lot, but we know what's important, and we can then tailor services to meet people's needs a lot better. So to answer John's question, although I think you did that, Simon, we can tailor things like virtual voices, so we can pick up views from localities, indeed even from towns, and it is truly representative of the population of Devon. I'd just finally just like to thank the team, to Nellie, Jean and John, who really do a lot of the engagement work, and they've been fantastic in helping us design different ways of engaging people, particularly during this phase of coronavirus. So we're just using new technology and new techniques to reach out to people. So I'd just like to thank them for that.
Thanks, Andrew, and please do pass on our thanks as a governing body to your team. This is testament to your leadership, yes, but to their hard work as well, and their skills, and I think we are hugely fortunate to have them within our CCG, and puts us in good stead going forward as we try and identify ourselves as an ICS with the patient at the centre. Glynis. If you're struggling to get on, Glynis, I know I said don't put your questions in the meeting chat, but if it's easier for you to, if it's a straightforward question or comment that you want to place in there. Oh, there we go. Glynis, I think I can hear you.
I have been struggling to get on. I was just going to say congratulations to Andrew on the Green Star, the Outstanding Award. I think Virtual Voices is a fantastic innovation, but I just wondered what we're doing to engage with people who aren't able to engage via a digital platform. If you could say a bit more about that.
Yeah, I can. Thanks, Glynis. I think you're absolutely right about that. I guess at the moment we are slightly challenged in doing that, but for me it's part of the work that we started to do earlier or very early this year and late last year, in really working with some of the local communities and with the voluntary sector to really ramp up our engagement. And we're doing that with our partner organisations, so with the providers and indeed with the local authorities, so that we can truly be better at engagement. And the idea, Glenn, is if we can start to do that earlier, then actually we will get better services as a result. The other thing for me is we've started within the CCG some training with our commissioners around the commissioning cycle, and of course as part of that you'll know that one of the active things that we need to do is engage with local people, with patients, with the public around commissioning services. So for me that is going to be hopefully something that will be much stronger in place as we go forward, as we move towards being a strategic commissioner in the system. And then the final thing for me is I have spoken with Susie about how we design an engagement process for the new partnership board and for the new system that has engagement on a county-wide basis with local people. But I think more importantly, I think what do we put in place for the 5 local care partnerships, who I think will do the bulk of strong engagement with local people, local stakeholders, the local voluntary sector, etc., etc. So I think we've got quite big plans, Glynis, but I think we are slightly challenged at the moment with some of the media that we can use. But I think once we're free from that, we will certainly do a lot more face-to-face with local people.
Yeah.
Thanks, Andrew. Sheila, I'll bring you in a moment, but just I'm noting people are, this isn't the normal Teams environment that we've used up until now for governing bodies. So governing body members, some are finding that it's not behaving in the way that they would expect. If you can't see the chat bar, don't worry, I'm keeping an eye on it, and I'll make sure that I bring people in and cover whatever's in there. We will make the technology work as best we can. So apologies if you're not getting full functionality of it as part of the governing body. Sheila.
Thank you, Chair. Andrew, bearing in mind that the topics that have been included, or the NHS England indicators include equalities and health inequalities, I wondered how good are we, and are we doing enough to engage with people who have communication difficulties, such as deafness, blindness. So we know that those people in particular have struggled enormously in both health professionals and patients in communicating through PPE, and it's very mindful to consider how we communicate with them and how they can communicate with us and engage with us as well. So be interested to know whether we are assured that we're doing enough.
I don't think we're doing enough, Sheila, if I'm honest. I think that's the area for me where we could do a lot more. So I think in terms of how to reach groups, people who have challenges, some of the diverse communities, we heard from Julia last month, didn't we, from who focuses on LGBT, and I know we've just started the review around some of the BAME groups, and I think for me, Sheila, that's the area where we really need to put a lot more focus in. There are pockets of good practice, so some of our providers and indeed some of our commissioners are doing work with the deaf and blind communities, but it isn't enough. It's not county-wide, it's in pockets. So I think for me, that's the area where we've really got to focus on in the year ahead.
Okay, thank you.
Thanks. And I think some of the questions here, and that one's no exception, it really illustrates that we may have achieved a lot and got that green star, but there is still work to be done. And Andrew, what's good to hear is there is still an ambition. We're going from a strong position to develop even stronger. It would be good to see your plans that actually make improve even further from where we are. It doesn't detract from the success, but I'm sure, knowing your staff, they wouldn't just want to sit back on that. They would want that to be the trigger to do even more in the effectiveness that we have with our communications.
You're right, Chair. If I could just add one point. So we have Charlotte, obviously, also who supports this work. She's very challenging in the nicest possible way around some of the work, and certainly reminds us about some of the things that we should be doing. That's great. The team really do like working with Charlotte, as do I. So I think for me, we do have ambitions, and I'm quite happy to bring our plans to the governing body chair in a future meeting.
Okay. Nikki, if you can take that as an action and make sure that we get that in the forward planner, and we'll discuss with Andrew when that would be appropriate. Thank you. Okay. Oh, Charlotte, you do have a question or a comment.
Sorry. I just wanted to add one thing that I think has been a recent addition, has been the reflective learning around engagement that I haven't seen before, but has been a part of the Tinmath work. So I think that's a really important factor and a real something I'd like to see sort of going forward. So the reflections around how learning from the engagement work all of the times, that kind of continuous learning cycle around what's working well as kind of targeting specific groups of people that it's felt we're not reaching. It's actually learning about what's effective when engaging in any way. So I think that's a real strength and something I definitely support going forward. And just to say, congratulations to the team, because they are fantastic.
Great. Thank you. I think that's a good comment to end this particular item on. Thanks, Charlotte, and thank you, Andrew. I'm not going to try and squeeze anything in more here. I think it would be more helpful for us to move around and stretch our legs and refresh if need be for the next 5 minutes, and then make sure we're back on. Please don't log off. You can turn your cameras off, but stay logged into the Teams and be ready to start the next item at 3:20. Steve, are you there at the moment? If you are, can you put could you put the Tinmath slide up, just the front slide, just so that people have got something to see if they join as a guest while we're waiting for people to come back? Thanks. Right, welcome back everyone. Governing body members who've just had a short 5-minute break before we go on to item 7.1, which is the modernising health and care services in the Tinmath and Doris area. Just before over to Joe Turl, who's our executive, who's been leading on this. I mentioned at the beginning of the meeting, but in case any members of the public have joined since the beginning, just to explain our plan, and then also I would just like to mention a couple of words to governing body. So first of all, if you are a member of public who's joined us, thank you for joining. I hope this is a useful time for you, and that you witness what I hope will be a proper process in trying to determine what is best for the population in this area. We do welcome any questions or comments that you have, bearing in mind that we've done the public consultation. So what we can't do, particularly because it won't be led by Healthwatch, which is what we had in the main public consultation, is we can't revisit that consultation in the way that we do questions and answers. But if you have any questions of clarification about the process that we're going through here, or any comments to make on it, then you should hopefully find on your screen a speech bubble with a question mark in it. And if you use that, you can post your questions. Myself and the governing body won't be looking at that, but our communications team will be, and they will be passing on any sort of questions or themes that come from your comments that they feel are important that we as a governing body cover. We may not cover all of them, and certainly sort of any views that are expressed that aren't constructive in this conversation, they will be present within that question and answer, but won't necessarily get fed through to us, as I'm keen that our governing body concentrates on the matter in hand. So thank you in anticipation for your participation in this process. For the governing body, I would like to ask you that we've been asked to make a decision here today on behalf of the CCG, and therefore on behalf of the population of this part of Devon. And I want you to make sure that as a body that you fulfil these 3 requirements before making a decision. And the first one is to assure yourself that the case for change has been presented in a robust way. To assure yourself, secondly, that the consultation process that has happened is sufficient, and thirdly, to assure yourself that the output from that consultation has been properly assessed and has been taken into account in the final proposals that we are presented with. We will then be asked to make a number of decisions based on that, but I will not be moving on to that decision making until I get a sense that we have satisfied those three challenges that I put before us. So Jo, over to you.
Thank you very much, Chair. Can I just check that you can hear me okay? A thumbs up
Yes,
will do.
we can, yeah.
Lovely, thank you very much. So I want to welcome everyone this afternoon who's attending from the public. My name's Jo Turl. I'm the Director of Commissioning for Out of Hospital Services and have been taking an executive lead in this process and consultation. Really pleased to say that today I will be joined in the presentation to governing body by Dr. David Greenwell, who is a local GP and also a member of the governing body, Jenny Turner, who is our head of integrated care in the southern locality, and Alex Cameron as well, who works in the communications and engagement team. First of all, I just want to say I feel really honoured to be the person that's here presenting this today, and I say that because this has been a huge team effort, and there are a few people I just want to thank before we go into the presentation. First of all, I want to thank Healthwatch, who I know are with us today, who've been supportive in undertaking a really independent consultation and producing the report on the back of that consultation for us. I want to thank their input for that. I want to thank the public, from whom we've had significant amount of response to the consultation process and also the original engagement which took place as well, and whether that was by joining online meetings, speaking to us on the telephone, or returning the surveys that went out to the population of the coastal locality. I also then want to extend my thanks to David, Jenny and Alex. As I said, it's been a huge team effort, so they're not the only people that have been involved in this, but I really do want to thank them for their input into this, because I know they have worked tirelessly over recent months, but also over a much longer period to get us where we are today. And I just wanted to recognise that work and the job that they've done, and I think that can really be demonstrated by the level of feedback that we've had from the public, and certainly the proportion of people who really feel that they've understood the proposals and that we've given them enough information to be able to respond to the survey which we've sent out. So the next thing I just want to be very clear about before we go into the slides is what we're consulting on here today. So this just be really clear for the governing body about the areas we're consulting on. So as a CCG, as a clinical commissioning group, we have a duty to consult on our services. We don't, and it's not our responsibility to consult on buildings and estates, but it is our responsibility to consult on the quality of our services, significant changes to those services in terms of where they are delivered and how they are delivered. So that's what we will be consulting on this afternoon, and David will take us through those 4 areas. So what we won't be consulting on this afternoon, what's not been part of the consultation process, is the Health and Wellbeing Centre itself. So that was a decision already been made to develop a Health and Wellbeing Centre. And also we won't be consulting specifically on the movement of the general practice in Tinmath into the Health and Wellbeing Centre. That's not part of this consultation today, but you will appreciate it's a really important part of us commissioning integrated services to the benefit of our population. Okay, so I'm going to take us into the main presentation now. So if we could go to the first slide, that's great, thank you. So I'm just going to take us through where we've come from, so the background and the vision to date. I'm then going to pass over to Dr. David Greenwell, who will take us through the drivers of change and the solution and process. I will then be handing over to Alex, who's going to take us through the consultation process itself. I will then be handing over to Jenny Turner, who will take us through the Healthwatch Report and the evaluation of the options for consideration that came out of the consultation, and also the quality and equality impact assessment. I will then pick up how hopefully we're assuring the governing body that we're meeting our statutory duties, and then we'll pose a series of questions to the governing body to give governing body the opportunity to ask questions, seek assurances. There will also be 2 opportunities for members of the public as well, as Paul said, who have asked questions. That will be before I start the questions to the governing body, and then afterwards, and then David will summarise for us and take us through the recommendations. So if I can have the next slide, please. Okay, so just a little bit of background, just for those of you who haven't been with us along the journey. But since the inception of the CCG, we've been working with our partners to develop health and care services in Tinmath and Dawlish that meet the needs of the population, but also provide those services sustainably into the future as well. So the original engagement took place back in 2013. A public consultation was undertaken at the time for the coastal locality in 2014 and 15, whereby the role of the Dawlish Community Hospital ward was expanded, and also the MIU hours were increased as well during 2015. The Tinmath Hospital ground floor was partly refurbished, and that was to create space for the enhanced intermediate care team, voluntary sector, community nurses, therapists, social care staff and support staff to work together. And it's been that has given us the evidence that we've been able to review to understand the success of that model, which brings us here today. The governing body agreed then, on the back of the success of that model of integrated working, to review the need for the rehabilitation beds back in 2017, which were never opened because of the success of the integrated model. An agreement was given to develop a new health and wellbeing centre back in 2017. Public engagement was undertaken back in 2018 to engage upon the location of the Health and Wellbeing Centre, and support was given for the Brunswick site. And then that brings us to where we are today, which is the public consultation around the 4 key areas of service change, which David will take us through in a moment. So if I can have the next slide, please. And at that point, I'm going to hand over to Dr. David Greenwell.
Okay, thank you very much, Jo. Just briefly to introduce myself, my name is Dr. David Greenwell. I'm a GP in South Devon. I've been practicing for the last 25 years, and I wanted to bring before you the reason that we're doing this whole process. But before we get into detail, I think it's really important that we remember what this is about. This is about people. And in particular, it's about some of the most vulnerable people in our community, particularly the very elderly, the very frail. And so as we're going through this process, we need to keep in mind that it's about them. It's not about buildings. It's not primarily about parking or any of the other details, which are important. But let's keep in the front of our mind that it's about those elderly people who need the best possible care. So one of the things we know about elderly people, particularly when they're in hospital, is that the longer they stay in hospital, the more that their physical condition is likely to deteriorate. Particularly, they're likely to lose muscle mass. They're likely to have a decline in their ability to balance. They're likely to have a loss of their mental functioning. All these things have been demonstrated by keeping older people in hospital too long. So we need to do everything we can to get them out of hospital and rehabilitate them as quickly as possible. And it's worth remembering that it's worth remembering that in hospital, we have done several audits to check who needs to be there. And as many as 1/3 of the people in the District General Hospital are there without needing to be there. They could be in another setting of care. And so it's our duty to make sure that we're moving people out of the place where we may be doing harm to them. And that's really the whole basis for our new model of care. It's to look after those people more effectively. So the big question is, does it work? And the evidence from Tinmath and Dawlish is that it does. They can produce statistics that show that there's been at least a 6% reduction in admissions, and an even bigger reduction in bed usage because of shorter lengths of stay. There's also been something called, we measure something called patient activation measure, the degree to which older people feel in control of their own health. And the new enhanced intermediate care service increased people's PAM, or patient activation measure, by 24%, meaning that older people felt more in control of their own health. And finally, and I think this is really important, there was a 10% reduction in people's use of residential and nursing homes following rehabilitation. So the number of people that went through rehabilitation and stayed at home increased. Now, this data, this information has been independently reviewed by the Southwest Clinical Senate, who are a group of expert and independent clinicians who looked at all the data and viewed the new model of care as being effective. So the new model of care is one of the reasons that we need to change the way we do things. And in particular, we have demonstrated that we don't need the 12 rehabilitation beds in Tinmath Hospital, and that we can look after 4 times as many people if we do it in the community. And that's one of the things that's driving change. The next thing is that we have an acute shortage of GPs, and we need to safeguard the future of Tinmath's GP practices. A lot of the practices are suffering from cramped space, deteriorating mostly Victorian buildings with access issues, and particularly a lack of disabled friendly entrances. This constrains the ability to train, particularly medical students and trainee GPs, who are going to be the future of our workforce. Thirdly, we need to make the most of the local community hospital estate. Tinmath Community Hospital needs significant investment, whereas Dawlish Community Hospitals are modern, fit-for-purpose building. And finally, the fourth reason for change is that we're completely in line with both national and local strategy. So if you look at both the Devon long-term plan and the NHS long-term plan, they both really feature the importance of integrated working. Okay, can I have the next slide, please? So what is our vision? Well, we want to build on the success so far of integrating services, the nationally recognised excellent integrated services that we have in Tinmath and Dawlish. We want to ensure the sustainability of primary care in Tinmath for the future, and we want to help people stay well and support them when they need help. And finally, we want to help people stay at home for as long as possible and not send them into a residential home before they need to go. Okay, and the next slide, please. So what are we proposing? Well, we want to spend £8 million in the centre of Tinmath to provide sustainable and fit for purpose space for integrated GP and other health and care services. And that last bit's really important, having GPs, community nurses, OTs, physios, and the voluntary sector all in one building, able to work together, will have a huge benefit for patients. The building's going to be modern, environmentally friendly, and it'll be energy efficient to run. So it will be much cheaper to run than the current premises in Tinmath Hospital. It is in the town centre, and we believe it is accessible. And it will accommodate Tinmath GP practices, the health and wellbeing team, volunteering in health, and pharmacy. And it will recognise the important role of local people that they've played in the hospital, and we want this to continue in the new centre. So next slide, please. So what are the proposals? Well, there's four proposals. The first is that we move the high-use community clinics from Tinmath Community Hospital to the Health and Wellbeing Centre in the town centre. And it's important to understand that of the people who attend outpatient clinics in Tinmath Community Hospital, 73% of those people will now be going to the centre in the middle of Tinmath town centre. Okay, so 73%. Now the specialist outpatient clinics, that's things that we would perhaps normally think of as being in the District General Hospital, as the specialists who come out to Tinmath. Those clinics will move from Tinmath Community Hospital to Dawlish Community Hospital, 4 miles away. And that's 27% of patient attendances at Tinmath Hospital. Now there's one exception to that at the moment, and that's ear, nose and throat, which will move into the town centre. The reason for that is that it needs to be with audiology, so that's why it's staying put. Then thirdly, we want to move day case procedures from Tinmath Community Hospital to Dawlish Community Hospital. This is minor surgery or minor procedures that require a specific treatment room. Now this is a service that's provided for the whole of South Devon, not just for Tinmath and Dawlish. And only about 14% of these appointments are for people living in Tinmath. The other 86% of people who attend for those minor procedures are coming from all over the rest of South Devon. And finally, we want to continue with the model of community-based intermediate care, reversing the decision to establish 12 rehabilitation beds in Tinmath Community Hospital. And just before I move on from that, I'd really like to just emphasise that those community-based intermediate care beds were never nursing beds. They were never medical beds. So they were never meant for people who were ill or who needed nursing care. They would have been therapist-led with healthcare assistance. It's important to understand that it is not the same as a community hospital medical ward. Okay, next slide. And I'm going to hand over now, I think, to Alex. Is that right?
Good afternoon. Thank you, David. My name's Alex Cameron. I'm from the CCG's Communications and Engagement team. David set out the proposal that was taken to consultation. The purpose of these slides is to summarise how we communicated and how we interacted with local people throughout that consultation period. The report before you contains our objectives during this process, but just to flag 2 of them, they were to ensure everyone who would want to take part is able to do so, and also to ensure that people have enough information to come to an informed choice and response about their feedback. And so this is all about initially here how we reached people. So faced with a remote consultation, we adopted very much a mixed approach involving some traditional and more modern methods of communicating to make sure that we reached all demographics, all types of household across this area. And I think that mixed approach is very much one of the strengths. The consultation ran for 8 weeks, as you can see from the slide, after some pre-publicity so that people were aware what was coming. And so let me just highlight a couple of those aspects that are on the slide there. So to begin with, traditional, we via Royal Mail delivered about 16,000 copies of the consultation document to households, pretty much all the households across the Dawlish and Tinmath area. And that's a 28-page document setting out the background to the proposal itself. And it also contained the survey form in hard copy, which was also available online as well. So before, as part of the consultation, this gave us confidence that before we'd even thought about responses, we had put the information in the hands of nearly every household in the local area via Royal Mail, which is very significant in terms of making sure that we had reached local people in the area. Moving to more modern methods, so on social media, which we use to promote the consultation, make sure people were aware in the digital space what was happening. There's an example of a simple social media campaign that we used to do a countdown towards the public meetings which were held online, and there's some sample graphics in the slide. these were posted on Twitter, Facebook, and other campaigns involved an image showing the types of topics that we'd be covering at these meetings. We also use paid for Facebook advertising to help us reach people in the Tinmath and Dawlish area, and that would spread awareness also of the meetings that were happening. We had about 47 posts on Facebook, 5 of which were paid for, with a high total reach of over 75,000 impressions. Back to the more traditional, perhaps, we took out paid advertising in the Tinmath Post and Dawlish Gazette. We had 3 half-page adverts that were run throughout the campaign. We also had a prominent homepage slot on the website of those publications, so that their digital audience would be aware of that, and that ran for 6 weeks too. We issued 8 press releases during the campaign, and they were well covered. They promoted what was in the consultation and the online meetings themselves. And the consultation was well reported locally, not just in the local papers, but was also covered on ITV West Country, TV News, and on BBC Radio Devon too. And we were very keen that accessible formats, as it says there, in terms of easy read, large print and audio and browser allowed formats were available. So moving on to the next slide, that's how we reach people. How did people reach us? How do we engage and get a two-way conversation going? So a challenge in the context of COVID, where face-to-face meetings were being avoided. But again, we deployed a mix of traditional and more modern methods so that everybody could take part. And that's set out in the report, the Healthwatch Report, and is summarised here. We were very conscious that even though we were remotely contacting people, that not everybody has access to the internet. So there's the opportunity to engage with us via letter, and also importantly via phone call. So Healthwatch manned a phone line where people could call us, call Healthwatch and put us in touch with them, and they could arrange to have questions answered, or to arrange a conversation with us separately if they wanted that one-to-one dialogue with us. In terms of the digital approach, we had online public meetings, and the format of those were that they were hosted by Kevin Dixon from Healthwatch to ensure impartiality and independence. We viewed the video that we saw earlier on, and there was a presentation all about the background and the proposals, and we took questions and answers via the function in Microsoft Teams from the people watching. I know colleagues around this digital table here today, many were involved in those presentations, and some of those questions were very challenging and really well asked, and the responses hopefully helped people understand our position and gave the information that they were needed. Those meetings themselves were held at different times of day and on different days of the week. And also just to highlight that we offered to attend groups locally, so digitally we could come to local groups that were meeting, whether they were constituted local groups or just wanted, to invite us along to talk two-way, and so there was very much that potential for that more direct engagement in terms of two-way conversations through those small group meetings. Moving on to the next slide. This is the activity recorded. So the response levels were good, with over 1,000 responses to the survey received. And I think some of the extensive coverage in local print and digital media drove that interest, as well as the social media promotion as well. We responded to the inquiries that came in the different formats that you see. And Healthwatch helped us from an independent perspective manage that in correspondence to make sure that people could get the information that they needed. It was free to contact us through free post or via free phone, and people could do that at a time when movement was difficult and meeting was difficult, from the comfort and from the safety of their own home at a time that was convenient for them, which I think contributed to the strong response rate that we heard, and that we also may have heard from people that we wouldn't ordinarily have heard from, because they had the opportunity to join direct from their home. And so with that summary, I'll hand over to Jenny.
Thanks, Alex. If we could have the next slide, please. So The whole point of the consultation was to review our pre-consultation business case and the proposals that made up part of that. So the pre-consultation business case was approved by NHS England and the governing body in February. But the role of the consultation is to go out to the public and to ask for their views and seek those alternative options. And the Healthwatch report is a really key part of informing our understanding of what the public fed back to us. And as part of that, on overall, we had over 1,000 responses, so 1,000 responses, which we consider a really good return rate and can be compared with the 1,400 responses we received during the consultation that we held across the rest of South Devon and Torbay in 2016. And you have the Healthwatch report in full in your packs. Most respondents were from the Tinmath and Dawlish area, as we would expect, and most of those were aged over 55 years old. In terms of understanding the proposal, 96.64% of respondents said that they understood the proposals being made, and 83% said that they felt that the reasons for change had been clearly explained in the documentation that we provided, either in the consultation document or in the range of supporting information that we had available on the website. And almost 3/4 of respondents said that they had completely or mostly been able to get hold of the information that they needed to be able to inform their decision making and their understanding. Next slide, please. So in terms of the feedback in the report on our model of care, so as David, Dr. Greenwell has explained, our model of care is really at the heart of our proposal. It is about integrated working and supporting people in their own home to help us achieve that vision of excellent integrated or joined up services. And as in the respondents, 89.73% of people said that they thought that that vision, that integrated services, was important. And then in terms of all 4 elements, so one of our questions said, if you take into account all 4 elements that David went through earlier, do you think or do you support the proposal overall? And 61.3% said that they did support that they did support the overall proposal to support the move towards more integrated working, and 34% said that they didn't. It should be noted that of the overall proposal, about 38% of Tinmath residents, 58% of Tinmath residents supported that, and 77% of Dawlish residents. And we should note that in some of the feedback, people noted that they wanted to keep Tinmath Community Hospital open and emphasise the value of the hospital to the local community. Next slide, please. If we go on to how people answered the individual elements, we can see on the slide here, 63% of respondents supported the move of the high-use community clinics to the Health and Wellbeing Centre. Comments around this element included those that supported bringing the services together in a more accessible location, but respondents also reported concerns about parking and traffic in the town centre. 44.9% of respondents supported the move of the specialist outpatient clinics to Dawlish Community Hospital, and 35.7% did not. It was noted by some that Dawlish was a more modern hospital, a more accessible building with better parking. But transport to Dawlish was also noted as a concern to some respondents, especially from those more rural areas outside of Tinmath. 45.1% of respondents supported the move of day case procedures to Dawlish Community Hospital, and 35% didn't. Again, the positive comments focused on the modern building in Dawlish, the access and the parking. Whilst there was concern about parking in Tinmath and being able, and if Dawlish had the capacity to accommodate those services. And then on the final element of the final 4th element about continuing community-based model of intermediate care and reversing the decision to establish the 12 rehabilitation beds in Tinmath Community Hospital, 31% did not support it, but 43.8% did. Many people noted how they would prefer to be cared for in their own home, but there was concern about the capacity of community services and the availability of beds in care homes. There was also concern raised about needing beds during the COVID pandemic. If I could go to the next slide, please. So that was the feedback from the questions in the survey report and some of the comments that people made as part of the survey. But that was only one part of the consultation. We also obviously received feedback from public meetings and the meetings that we undertook with community groups. In the public meetings, the feedback was like we're using today. People were able to type in questions and the panel was able to respond. But in the meeting with community groups, those were held in a more interactive environment, either via Zoom set up for us by Healthwatch or via Microsoft Teams. And this feedback also includes the feedback that came in the correspondence that we received. So other than just a survey, we received a number of emails and letters, and this summarises the feedback from that part of the consultation. So there was support for the integration of services and the idea that services being joined up so that care could be coordinated around the needs of individuals, that people could talk to each other and easily communicate to ensure that the best possible care was given to people. There was also appreciation for the work of the GPs and the community teams in the area, with people citing the excellent care that they had from those teams. And there was significant support for a health and wellbeing centre. But there were concerns raised as well, and as we've already heard, concern about lack of parking at the Health and Wellbeing Centre and indeed in Tinmath Town Centre in general, and the parking capacity and cost at Dawlish Community Hospital. There was concerns around the increased traffic in Tinmath due to the Health and Wellbeing Centre, even though the GP practices are already based in the centre of Tinmath. There was a concern that the move of the local community clinics there would create more traffic, and the trouble for some people, especially from the more rural areas outside of Tinmath, to access those services at Dawlish Community Hospital. If I could go to the next slide, please. People also raised questions around why Tinmath Community Hospital couldn't be updated and why that couldn't be used as a site for the Health and Wellbeing Centre. And there was concern at loss of a very valuable community asset and the closure of the physiotherapy department at Tinmath Community Hospital, which has recently been updated and has received a lot of support from the local League of Friends. And concern about the ability of local services, especially those where beds are required to cope with the COVID pandemic. There were some concerns about the quality of communication between teams and primary care working out in the community, and the continuity of care. Capacity at Dawlish Community Hospital to deal with the new clinics, and capacity of the workforce to deliver community-based care. And there were some concerns about privatisation of NHS services, especially in terms of private companies being used to support our development of a state. Not as part of the consultation, but outside of that, we have also received a petition via Devon County Council Health and Adult Care Scrutiny Committee on the 12th of November. And the title of that petition is Save the First Purpose-Built NHS Hospital from Closure. 467 signatures were added to that petition during the consultation period, with fewer than half of those giving addresses in Devon. 14 letters were also sent to scrutiny members, who have kindly forwarded those on to the CCG post-consultation, mainly emphasising the value of Tinmath Community Hospital. And 3 letters were received during the consultation from Anne-Marie Morris MP. Next slide, please. As part of the role of Healthwatch was to bring together all that consultation material and to identify, as part of it, any alternative options that the public had come up with. We were very clear and very aware that we had gone out to consult on one option and one proposal, and therefore were absolutely determined to keep an open mind on if there were any other options that we hadn't thought of in our pre-consultation business case. Now, when we developed our pre-consultation business case, we used the Coastal Engagement Group to help us support the identification of options, but 18 options were alternative options were identified working with Healthwatch. Now, all the options verbatim are listed in the Healthwatch report, but the steering group working with Healthwatch identified 8 alternative proposals to be considered by an evaluation panel. This did not include the proposals in the scope of the consultation, although these are included in the report, but there were 5 broad categories. Various configurations to refurbish Tinmath Hospital to deliver services, including rehab beds and medical beds, so there was 4 options around that. Redeveloping Tinmath Hospital to deliver services similar to the above, but one option did include moving all the services from Dawlish Community Hospital to Tinmath. There was 3 options there. And the third category was the use of the Health and Wellbeing Centre on Brunswick Street to deliver additional services, and there was 5 options for that. There was 2 options around alternative location for those services to be based either in Broadmeadow on the outskirts of Tinmath or between Tinmath and Dawlish, keeping Tinmath Hospital as it is, and having rehab beds in either a new unit in Tinmath or at Dawlish Community Hospital. A panel made up of reps from GP practices and patient participation groups, League of Friends and the voluntary sector, Torbay and South Devon Foundation Trust, the CCG, Tinmath and Dawlish Town Councils formed the evaluation panel, and they met on the 1st of November to discuss the alternative options with advisors from Torbay and South Devon Foundation Trust, Timbridge District Council, Devon County Council, the CCG and Healthwatch. The criteria used was the same criteria used to identify the original options and to score those, and it was weighted high, medium or low. Supporting the vision, sustainability and clinical evidence and finance were all weighted high. Public transport, car parking, travel impact and pedestrian access and the impact on the local vicinity were weighted medium, and environmental impacts were weighted low. A 2-stage process was used, with options first being assessed in terms of space and capacity, and those with a positive answer at this stage went through to stage 2, and they were scored using the criteria, and the scores for each option are available in your report. The final part of information that we took on board when assessing and reviewing the outcomes of the consultation was the quality and equality impact assessment. So in November 2018, a QEIA on the potential options was reviewed by the CCG panel. This was updated again in January on the options proposed and refreshed again in December 2020. The quality impact assessment concludes that the likely outcome on people using services affected by this proposal is beneficial, and the details of that are in your pack. The benefits are mainly around more modern facilities which conform with modern safety guidance and standards, and compliance with national standards, and improving the patient experience, especially in terms of pedestrian access and improved environment. The equality impact assessment noted benefits for people with physical and sensory disabilities related to a more level site, people aged over 65, and I would particularly bring your attention to that it was seen as a benefit to people living in the most deprived area of our community, which is the Tinmath Town Centre and seafront. So just in terms, next slide please, just in terms of how we brought all that together, The evaluation of alternative options, we noted that 4 of those ended at stage 1. All of those related to putting additional services in the Health and Wellbeing Centre because the space wasn't available. One option, option 12, scored highly, moving the specialist orthopaedic clinics to the Health and Wellbeing Centre rather than Dawlish Hospital. That's because space is available, there's a low capital cost involved, and it brings further integration with the community physiotherapists and primary care, much like the ear, nose and throat clinics. And so that additional option was added to the recommendations. 2 options scored medium, and all the other options received a low score. We also reviewed the suggestions that built on the proposals coming from the feedback. And one of the suggestions was that other services such as mental health services could be delivered from the Health and Wellbeing Centre, and we have added that to the recommendations. Another option was, or another suggestion was around the additional office space for community staff in Dawlish Community Hospital to allow them to have 2 office spaces that they could use when working across the patch, and that has been added to the recommendations. In terms of the review of the Healthwatch report, the steering group noted that almost 2/3 of people supported the proposal overall, and more people supported than did not support the individual elements of the proposals. We did recognise the concerns raised from the Healthwatch report around parking, and that has been included in the recommendations. And we also noted the beneficial impact assessed by the EQIA on both quality and equality, especially of people living in the deprived area. Therefore, the steering group coming together agreed that the proposal should be recommended to the governing body as it stood originally, but with the addition of the items that I've just highlighted that came as a direct feedback from the consultation. So I'm now going to pass over to Jo for the NHS England's 5 tests.
Great, thank you, Jenny. If we can move on to the next slide. Yes, so the NHS England's 5 tests, and in a minute I'm going to take us through the gunning principles. So the 5 tests, and this is what governing bodies should hold in their mind when we get to the questions, are that we've undertaken strong public and patient engagement, consistency with current and prospective need for patient choice has been taken into account, support for proposals from clinical commissioners, clear clinical evidence base, and the patient care test. If you just hold those in your mind, I just want to take us on now to the gunning principles on the next slide, so that we can get to the point where we can answer some questions and get to discussion. So first, the gunning principles is that public bodies need to have an open mind during the consultation. I hope what you've heard is we consider this to be really important, particularly given that we only had one option. We've given people the opportunity to put forward alternatives and been really clear about that at every opportunity, particularly on the online consultation events. We've evaluated using the same criteria as we did originally to come up with a proposal. And as you will see when we get to the recommendations, and we'll have seen in the paper, one of those scored highly and is actually one of our recommendations at the end. So hopefully this demonstrates that we've kept an open mind throughout this consultation. Second of the gunning principles is making sure we supplied people with all of the information that they need. As you've heard, hopefully, but I will reiterate, 97% of people said that they understood the information they've received, 83% that they understood the reasons for change, and 74% said that they had enough information, all the information that they needed to be able to respond to the survey. And of course, they did have the opportunity to speak to us individually if they wanted to as well. The third principle is that there must be adequate time for consideration and response. So we've obviously been on this journey for a very long time, with several points at which we've engaged with the public, but also, of course, have completed an 8-week-long consultation process as well. And the fourth of these principles is that the feedback and the responses given at the consultation must be conscientiously taken into account. Well, I hope by the fact that Jenny has gone through very thoroughly the Healthwatch report. You can see that we've taken that into account, along with the quality and impact assessment and the evaluation of the alternatives as well. We also attended scrutiny, so the Devon overview and scrutiny on several occasions. So one of the recent occasions which we attended, which was to keep them up to speed with where we were with the consultation, but also to gain their views, was in September. So on September the 10th, we attended. We went through with them our process for consultation, the methodology we were going to use, how we were going to evaluate. And it was minuted there at that scrutiny committee that the quality and the clarity of the consultation materials that we were providing and were widely distributing was commended by the scrutiny committee. So that gave us really good confidence and assurance going into the consultation that we were doing the right thing. At this point, I just want to take the opportunity to say that we added a late paper into the public papers, and that was because we only received that late on yesterday. And that's a follow-up response from a spotlight review that was undertaken on Monday with scrutiny committee. So I'll just explain what that is for a moment. So it's not part of the formal scrutiny process from the council, and it isn't attended by all members, but members are invited to attend if they would like to. Terms of reference for that review were that they were there to review the Healthwatch report and the process which Healthwatch undertook, and also to review the evaluation process as well. It's really important, I think, the governing body are aware of these concerns, so I am just going to take you through that, although people have had the chance to look at them, but I will briefly take you through that. There are a couple areas that I just want to flag first, though. So the first one is to acknowledge that in the response we received from the Spotlight review, that members accepted that the CCG had demonstrated the need for change. Also, that they commented on the over 1,000 responses we got for the population of this area, which, as Jenny's outlined earlier on, is significantly more proportionately than we've received in previous consultations. I think that's a really good, again, really good credit to the team for that. So they focused on 4 areas that I think it's just really important the governing body consider that they have assurance on. So the first one was the survey itself. The response from the Spotlight review was that the CCG determined the survey, as of course you would expect us to, but also that there were closed questions within that survey. So I just wanted to assure the governing body of a few things. First of all was that the survey was conducted and we went through the proposed questions by engaging in the coastal engagement group and also with Healthwatch as well. And our Plymouth researchers. So many people have had input into those questions to making sure that we got that right for the engagement process. Also want to remind us, of course, that we had lots of opportunity to ask really open questions to the public as part of the engagement, which led up to the consultation. And as well, just to say for those of you who haven't read the survey yourself, yes, there are some closed questions in there, as you'd expect, because we needed to get a yes/no answer about whether people supported, but there was always opportunity to provide free text as well, which features in the report. Second area which the Spotlight review highlighted was that there was no opportunity for interactivity on the online sessions, which of course is a slight limitation to just where we are currently in ability to do that. But I do just want to assure governing body again, for those that weren't present at any of those sessions, that the public were allowed to answer questions. We answered all questions. We also gave people the opportunity to follow up as well on those questions if they didn't feel they were answered. We also offered public the opportunity for us to go to their meetings as well. So if they held online meetings, we were quite happy to go to those, and they were an open forum where we could have those sorts of debates. And we also offered individuals phone calls as well. Third area that I just need to pick up then is about patient experience in the evaluation process. So I just want to be really clear that there was a stakeholder group that was involved in setting that criteria for the evaluation process. Patient experience, although it wasn't a specific criteria on its own, the whole idea was it was littered through all of the criteria. So when we went out to engagement originally with the public, we asked them what good looked like from their perspective. So actually, what was good care, good patient experience for them? They were really clear that this was about having local services, only telling their story once, continuity of care and access, and being able to stay in their own home. And that's what good experience looked like to them. And I think that's really well covered if you look at the criteria in terms of some of the questions. So questions such as, does the proposal support commitment to provide local services in the locality? Does it build on further integration? Does it enable people to stay at home? And also it looks at the availability of things like transport and pedestrian access as well. And then the fourth area that was raised by the Spotlight Review was concerns about the merits or not of the rehab setting, that they felt may or may not have been presented well, and our belief in its effectiveness. I think at this point, I think you've heard really thoroughly from David. I think we can pick up further questions if we need to, but you've heard really thoroughly the evidence around the model, around rehabilitation. And I do just want to point out one thing. I do want to quote from the Clinical Senate review, and this is in the paper, is that they said it seems very clear that the CCG do not need the 12 rehabilitation beds. So at that point, I'm going to pause. I'm going to hand back to Paul to feed through any questions that we've received, first of all, from the public.
Thanks, Jo. I will go to governing body first. I've got a couple of questions come through that I will mention in a moment. Thanks, Jo. Thanks to your team. Just before we do the questions, we need enough time to get through this. And because of the detail that you provided us with, I don't want to curtail the debate discussion that we need to have. And so in order to do so, I'm going to take all committee chairs' reports and locality reports as read. There were two committees that met this morning, Finance and Quality, and I'm going to ask those chairs if there are issues that they have to urgently escalate to governing body that cannot wait till January to put that in the chat. But otherwise, I will take those as can be come through the normal processes in January, in January's public governing body. And that then allows us the time now to just focus on this single item from here on in. So first of all, any points of clarification or any questions from governing body members? I know Jo and the team have a series of questions to help us focus, but anything initially? Simon Kerr. John Walmsley, you want a question as well? You come in while Simon's finding his unmute.
Lovely, thank you, Chair. So, Jo, my question's around the stakeholder group that was used to determine the evaluation scores. So I think that's really, really important. So it looks to me as if the clinical challenges were scored as very high, and the medium group were largely around social challenges, around transport and access and that sort of thing. So I'd like to know how you chose the makeup of the stakeholder group to set those evaluation criteria, because I need some assurance that actually that was representative, truly representative of what people felt was important about how we set these criteria.
Yeah, of course, John. Very happy. Really good question. I'm going to ask Jenny to pick that one up for us.
Thanks, Jo. So we wanted to use the same evaluation criteria as we used for the original evaluation, John. So when we talked about it in the end of last year, when we were looking at the original options, and we took some advice from the Consultation Institute as well to make sure that we got the makeup of that panel right. Yeah. So we used our coastal engagement group, which is made up of local GPs, the voluntary sector, patient participation group, and the local community teams to support us in coming up with the options. And then to keep the criteria separate from that, Timbridge CVS supported us in coming up with a stakeholder panel, and they came up with the evaluation criteria that we should use. Then when we came to evaluate the alternative options this time round, we used the same criteria to give us that consistency across the two processes.
Lovely. Okay, thank you.
And John, are you happy that that then means it can be as representative as any panel can be in our efforts to try and just take a sample to be the voice of our whole population?
Yes, so the setting criteria is one thing, and then allowing people to sort of to mark against those criteria is, of course, the second checkpoint. And I think I am assured actually that's a good group there. You've got a voluntary sector coming in there, which I like the idea of that, and the other groups. I think that's representative. So thank you.
Okay, thanks. And Simon, are you now off mute?
I'm sorry, Paul. Yeah, to try to answer two of the challenges you gave just at the beginning, to give myself assurance around the consultation process, I'd like to know how representative you felt the selection of people that actually answered the survey were of the people that actually use the hospital, because it seems that about 60% of people that answered the question don't actually use Tinmath Hospital, and 70% don't and haven't used Dawlish Hospital in the last year. And the second question was about really the model of care. Having been part of a lot of those conversations in the eastern locality, I know critical to the future delivery of the new model of care will be working with social care and understanding the potential capacity of community services going forward, and whether that's well matched to potential demand that might come through given the demographic that might be changing in the coastal area. So just wondered how much modelling we've done, how much data modelling we've done to know that we're going to have both community capacity and also social care capacity to maintain that model of care in the coastal area.
Yeah, thank you very much for those questions, Simon. I'm going to hand over to Jenny in a minute. In terms of your first question, so your second question was about demand. Sorry, just remind me your first question, Simon.
The question was really about the robustness of the consultation.
Yeah, sorry, yeah. Was it representative or not? Yes, thank you. Yeah, I mean, Jenny went through I think, and in the report it detailed the sort of demographics in quite a lot of detail about who responded. I think that there's always going to be a slight bias in these things, and it feels like actually when you compare the results we've had this time compared to results in the past, actually we've been able to expand and broaden the range of demographics of people that have contributed to this. I think that what is really important, so you say, you know, about the proportions of people who use the services, I think what's really important is we do get that wider view, because this is overall, this is about the healthcare provision for the whole population, and it's really important that as commissioners we consider the whole population and all of the services that the population need to be able to access, and not just now but in the future. So I think it's really important for us to try and reach groups of people who actually aren't quite at that stage yet, and what would they want for future provision as well. I'm just going to hand over to Jenny, just see if you want to add to that, Jenny, and just pick up the bit about modelling.
Okay, thank you, Joe. So I think I would echo, Joe, what you've said around the demographics. We went to a lot of effort, as Alex has explained, to get the consultation document into the right people's hands. They have to choose then whether they want to take part or not. And we really wanted to focus on people that might use those services. If we're going to have a model of care that is really about supporting people in their own homes, that is people that are currently using hot services, but it will also be for those people that will use services more in the future. So I am not worried that that people came back and responded that didn't use the services. I would expect them to do that. Sorry, Sam, can you just remind me of your second question around the modelling?
Well, it's just how do we know that the new model of care is going to be sustainable in the future, given the potential demand and potential capacity that we might have, both in social care and community services?
Yeah, and I think that's the massive question to answer, isn't it? Whether it's going to be sustainable in the future. I think the only thing that we can do is make every effort that we can to make it as sustainable as possible. And we know that if we put GPs in the right buildings, that we'll be making a huge step forward in making those services sustainable. We also know that by integrating those services, the community services and the voluntary sector, really important, in with primary care, that we'll take another step towards sustainability. And the more services that we can deliver in the community rather than in bed-based care, again, you make a more sustainable service. Yeah. And I would just add, in terms of recruitment and retention of staff, being involved in an integrated project around primary care networks, it does make it a more attractive place to work and therefore more sustainable in terms of your staff retention.
So just to add into that, so Jenny's right, it's always really difficult to know what's going to happen 10 to 20 to 30 years, but of course we have looked at that immediate period. And I just wonder, at that point, I'm going to bring in Liz Davenport, who will introduce herself, and she's joined us from the trust who will be providing these services.
So good afternoon, everyone. It's Liz Davenport. I'm the Chief Executive of Torbay and South Devon Foundation Trust. And just to add to the comments that both Jenny and Joe have made, clearly this is an area of ongoing focus for the Trust. We're continuously reviewing the demand information and looking at how we respond. We know already that we're able to provide far more care for people at home, effectively delivering good outcomes in a home-based service than we can in a hospital-based service, which is already been important. We've continuously reviewing our workforce modelling to look at how many staff that we need to continue to do that, and moving more of our therapy-based staff, for example, into community settings through things like discharge to assess models to increase capacity. We've also established really strong partnerships with other provider organisations, including the care sector and the domiciliary care partners, so that we build on that capacity, and are doing a lot of forward-thinking work with our partners in education to make sure that we are recruiting and training the people that we need now into the future. And we've got a really positive opportunity, sadly, on the back of what has been a very difficult situation with the pandemic, to really bring more people into the health and care sector. And we've seen a significant increase in the numbers of people who are showing an interest of working in the health and care sector in the last few months, and we're really capitalising on that. Great. Hopefully that helps answer.
That's really helpful. Yeah, thank you very much, Liz. It's really helpful.
I think it's helpful because this kind of links in to bring in one of the questions from the public at this point, and Liz, I think we'll be looking to you because it is about the sustainability of this, and you've talked about it from a workforce perspective, but I think this picks it up from an increasing number of people wanting to, needing to use the service, needing acute intervention, an increasingly older and more frail population. So if I just read it verbatim, I think it's probably most helpful, which says, if care at home is so successful that beds at Tinmath Hospital are no longer needed, why are the three indicators of outcomes for elderly patients all high and rising? And the three they quote are emergency admissions for over 70s, emergency readmissions after discharge, and delayed transfers of care. And they say they got that from an FOI from yourselves during this month from the hospital. And their supplementary question is, why does Torbay Hospital have one of the worst emergency readmission rates in the country? I don't, that's probably not one for you to specifically answer here within our governing body, but I think it just puts in the context that if Torbay is under pressure from those three elements, what is our confidence that the model that we are proposing continues and actually expands within the Tinmath and Dawlish area is delivering now and will deliver in the future?
Okay, thank you, Paul, and thank you, John, for the question. And clearly these are very important issues for us, and it's an area that we continuously focus on, and also it's a source of continued focus for the CCG and the Trust in our oversight meetings. So we recognise the issues. In terms of delayed transfers of care, our starting point is we've had some of the lowest delayed transfers of care in the country and have had for a considerable period of time, and our current position remains positive, but not where we would want it to be. We have experienced some challenges in terms of our ability to the capacity within the domiciliary care sector, but just linking into my previous conversation, we've worked very closely with our partners both in the domiciliary care sector and with the county council to address some of those issues, which I think have led to a significant improvement. We've also improved our coordination of care by establishing a discharge hub. So the sort of things that you would expect us to do to make sure that we improve our efficiency, because this is about using the total resource we have as efficiently as we can. The readmission rate, I'm not planning to get into the detail of that, but I would say that we have changed pathways into the hospital to improve safety and timeliness of access to emergency care. And as a consequence of that, there is a data issue that's arisen out of that, which goes a significant way to explain the increase in readmission rates. It's about a pattern of service utilisation, not a service, not wholly an issue about patient experience.
And I'll just, if it's okay, Paul, I will just add to what Liz has said, because actually I think that's quite I think completely agree with everything that Liz has just said. I think it's a difficult question to answer because, of course, we don't know the detail of the data that we're referring to in here. We don't know what time period it's comparing to what group of patients. So I think that's really difficult, because actually if you're comparing year on year, you might expect some increase anyway, and that's not a bad thing. That's just about demographic growth. But what we can say is, when we looked at the data and the evidence that we brought forward into Clinical Senate, what we can demonstrate is that that particular locality does have lower admissions and does have lower delayed transfers of care, etc.
Okay, thanks. Thanks very much, Joe and Liz. But for me, certainly, it's helpful to know that what is specific about that coastal area, the specific metrics that we have about some of those markers for our older people on the coastal area needing that emergency care. I think Sheila, you were next wanting to ask a question.
No, thank you. My question was related to another item. Apologies.
Okay, all right, no problem. Judy. If your camera will go on and come off mute, Judy. I will give you a moment to try and sort that out. I'll come.
I'm on. I wonder if somebody else was trying to put me on and we were negating each other anyway. Joe, I just wondered quickly, were you surprised by the report you got yesterday from the Spotlight Scrutiny Committee? It just seemed a little unusual to me.
Joe, no, you're on mute.
That had to happen at some point this afternoon. Thank you, Judy, for the question. Yeah, I was a little surprised. I think we were a little bit taken aback as a team, because we've been working really closely with scrutiny over, well, particularly over the last 6 months, but certainly a much longer period than that. And they've been really supportive of the process that we've undertaken so far. And indeed, I think earlier on I quoted from the minutes in terms of them actually commending the quality and the accuracy and the clarity of our consultation materials and how widely we were distributing that. And certainly conversations we had at the time really commending the type of consultation process that we were using. So I think particularly because two sort of questions pertain to that, really. Yeah, I was a bit surprised to have that, but hopefully we've been able to reassure governing body this afternoon about the process we've undertaken.
Thank you.
Okay. And can I then just bring in another question for the public? We're going to come to Graham in a moment, but just before we do, so Councillor Sylvia Russell, and I know you covered this a little bit, Jenny, but I just wonder whether you can describe a little bit of the detail behind it, because Councillor Russell is asking whether the governing body has had the opportunity to consider alternative options to deliver this new model of care within an enhanced Tinmath Hospital campus. And I know on page 24, 25 and so on of your report, you cover some of those options and the scoring. And that one came back in the medium. And can you just articulate for the panel what were the strengths in that and what the weaknesses, and eventually the concluding moment that decided that that wasn't one that could be considered viable?
Thank you, Paul. Yeah, that option actually was evaluated twice. It was either developing a new build on the Tinmath Hospital and site. It was considered for the Health and Wellbeing Centre, that site, and it was discounted for that reason because of its location and the feedback from the public engagement wanting the Health and Wellbeing Centre in the centre of town, so it was accessible to everyone. Then it was considered as an option back at the end of last year before we went to public consultation, either to do a new build on the whole or part of that site or refurbish the existing site. And it was discounted then because it was considered that it didn't add to the integration with primary care, that the building wasn't sustainable and would require significant capital to make it fit for purpose. And the access, wasn't considered by those that scored to be great. It then came out as an alternative proposal again through the consultation, and so it was reviewed again in terms of that. And as you say, the score came out as medium. Now there is a capacity on the site to do that. The building does need extensive renovation, and so the capital cost of that refurbishment would be considered really high, the same as if you were to do a new build. Keeping the services on this site would not achieve the further integration with primary care. The pedestrian access is considered poor, and so for that reason, the steering group didn't think that it was a proposal that should go forward as a recommendation to the governing body.
Okay, thank you, Jenny. So just to be true to Sylvia's challenge, I'm going to ask my governing body colleagues whether what you've read in the paper and what you've heard just now from Jenny, whether you feel that that is sufficient consideration of that proposal, that you agree with the group that decided that that wasn't a viable option that should be taken forward, and it's an opportunity for you to raise a concern or any further concern at this point. Okay, thank you, Jenny. Then thank you for that. Graham.
Thank you, Chair. Can I just check that you can hear me okay?
Yes, I can.
Thank you. First of all, let me just thank Joe, David, Alex and Jenny for a very thorough presentation this afternoon and for very thorough written reports, which we've had throughout this process, I have to say, right from the start. And also congratulations on the consultation exercise, which in my view has been exemplary and a leader for others to follow. My query is about parking and transport. A significant number of people have raised issues concerned with parking and transport, and whilst transport itself is of course not a health service or a social care service, it can facilitate access to health and social care services. And if we look wider afield, certainly Wales and Scotland, but also Yorkshire, Somerset, there are a number of initiatives where local authorities and CCGs together have looked at facilitating transport to surgeries and clinics, particularly those that are not well served by existing public transport services. So whilst I welcome proposal H in the proposals, which talk about mitigating parking issues, I'd actually like to propose that we add an additional recommendation to the proposals, which I'll call little I, so that it follows the one on parking. And that would be for us to work to further support and enhance the development and implementation of community transport. And I would see the CCG working with the Foundation Trust, with the two local authorities, and of course with the voluntary sector to see whether we can make it easier for those more vulnerable and elderly people that David talked about get to these excellent services. So that's a sort of formal proposal to add a recommendation, if you like, to the end of the recommendations. Thank you.
Okay. So Joe, can I have your initial response to that, and then and then see if there is support for that within the governing body?
Yeah, thank you very much. I think that's an incredibly good suggestion, actually, Graham. I just wanted to assure as well, governing body, of course, this access, transport was taken into account within the criteria. This will affect negatively a few people. It will also have a positive effect for quite a few people as well. And I'm personally am very supportive of that recommendation if governing body choose to add that this afternoon.
Okay, so it seems like it seems like a good proposal from my view, Graham, but I'm keen for everyone else. It's difficult to get votes on Teams for these elements, so I'm going to ask people just to very simply put Y for yes, N for no, and A for abstain within the meeting chat on this item. Okay, so I have had consistently, that's unanimous Ys that have come through. So in which case, Joe, when we come to the final list of recommendations, can we assume when we go through the list that that is included, and we'll ensure when we write the formal response to this that that has been incorporated into those proposals as part of our decision making? Thank you. Now, with all the Ys that have gone in, I have to scroll up quite a way to get to where we were. So, Nick Kennedy.
Thank you. My question really follows on entirely from Graham's. I too was going to ask about transport because it was extremely noticeable to me that was one of the really big issues. I have to say, I think the clinical case made by David and the clinical issues are very well covered, and I support them. But the proposal about community transport is a very sensible one, I think. But my question is more about public transport, and there have been a number of comments about just how desperate the public transport to Dawlish Hospital is. Have you looked or consulted with the public transport providers about the possibility of increasing services, or is that something that could be done? Because whilst community transport may be good, it presumably has to be booked and that sort of thing, and public transport is, if it's available, is clearly much more flexible. And I got the feeling that was quite a concern from some people, and I think that's something that should be addressed. So could you just clarify how much thought went into that and whether there's anything more we could do? Thank you.
Yeah, of course. Thank you, Nick. I actually think that's a really helpful another question, actually, because as you said, there will be a few people that will be negatively affected by the extra distance to Dawlish. I think what's really helpful in this is speaking to the district council. They have their policy is all about improving public transport, so I think we've got a really good opportunity here to continue to work with the district council in terms of describing how we could help enhance that public transport to Dawlish Hospital. You'll see one of the recommendations that we'll get to in just a moment is that we will ask the trust to continue to have that conversation with the district council to do exactly that, and I'd be really supportive of that as a way forward.
Thank you very much, Joe. And I know it's just an opportunity whether Liz from the trust wants to add anything to that, bearing in mind that if we do go through these recommendations, there will be that specific ask of you.
Thank you, Paul. And this clearly is something that we've talked consistently about throughout the process. I think the recommendation is a sensible one, and I think we heard very clearly from the public that they wanted us to look very broadly at transport, public transport, but also access to other things like cycle routes. So I'm very happy to take that away as our part in helping resolve that particular issue.
Thanks very much, Liz. I don't know if your camera is not working, but if we come to you again, if it's able to come on so that people can see you, that would be great. Glynis.
Yes, I just wanted to be assured that we've taken into account any impact that the COVID pandemic may have on our proposals, particularly in the way that might change the way that we might do things in the future. So I'm thinking of perhaps fewer outpatient appointments, more digital appointments for outpatients, as one example of how that model of care might change.
Yeah, thank you, Glenn. That's a really good question. Actually, I'm really glad that you've asked that. So what we did before starting the consultation, I'm sure Liz will want to comment on this as well, but I'll comment on it first. So before we launched this consultation, what we did was go back and review all of the plans that we had. Just because actually it had been a period of time since we'd last got together the proposal, but also because of course the impact of COVID. And actually, in terms of how we can deliver services moving forward, that's actually a really positive impact, as you said, in terms of a digital first type approach. So what we did was work with the providers to understand whether there were some changes that they would need to make. And actually, there are some really positive changes. So actually, there's not such a need to have specific consultation rooms for face-to-face, but actually the necessity to have pod areas, for example, so that we can do those digital face-to-face consultations. So actually that's had a really good positive impact, and we've reviewed the plans as well to make sure that they are safe from an IPC perspective as well. So in terms of infection prevention control, different entrances, exits, where people can wait, we've made sure that they're all safe for that, so confident about that. But I will just ask Liz, she might want to comment in terms of the implication for service delivery as well.
Thank you. I understand that there might be a bit of a problem with my camera, so you can't see me, which might be a blessing. So apologies for that, but I've tried every variance I can. So I will continue to speak. Joe, I think you've covered most of the issues. So we have, in terms of the pandemic, clearly it's been a real challenge on a number of fronts, but it has been one of the key drivers for innovation, particularly around how services are delivered, how we organise services, but how we use digital technology to improve access. And we see the opportunity to build on that over the next months and years, not least because we have a strong intention to progress our digital strategy alongside the STP digital strategy and invest in technology that not only supports people in our communities, but also improves information sharing in our hospitals.
Thanks very much, Liz and Joe. Glynis, does that cover, do you think we have addressed that ultimate way of working enough in this?
Yes, I mean, I think that's a good answer. I just, it just strikes me that the transport issues may not be as great as we're perceiving them if we move, if actually a lot of the clinics moved to more of a digital way of working.
That's a really good point, Glynis. Yes, I think very well raised.
A really important point, and we know that in itself can improve access to services, and we're really keen to see that developed.
Okay, thank you. John. No, John, you came off mute ever so briefly and then straight back on again.
Okay. So can I just commend Healthwatch, what I found a very, very useful report. I'd support Graham and Nick about the issues around transport and access. And how do we know those are big issues? It's because of the report the Healthwatch produced, verbatim quotations, again and again and again. I picked up a theme that people understood the clinical model here, but there was an underlying anxiety over transport, parking and access. So I too felt the recommendations weren't quite strong enough. I needed to make sure that we actually do address that concern. Although the clinical model absolutely must come first, those social challenges are very, very important. So thank you to Healthwatch for what I found a very, very helpful report. Just a quick question to Liz. There were just one or two sentences in the CCG report that led me to just ask, is there any connection between having to sell off Tinmath Hospital to complete your health and wellbeing centre? And that's just a direct question. I know it's valued at 8 million, and the plan seems to be that after we've done all these moves, if they take place, they would then sell off the site. Is it dependent on that to complete the health and wellbeing centre?
No, it's not dependent on that, and I think it's important that we separate the issues. So we're consulted on where services will be delivered. There will be a consequence to Tinmath Hospital if the recommendations are endorsed by the governing body, but I would be really clear, all the resources would be reinvested in the delivery of health and care services.
Lovely, thank you.
Okay, Paul, I was just going to thank you. So John mentioned the Healthwatch report, and I know I thanked Healthwatch, but I just want to say that Sarah Bickley is on with us. So I just want to say a huge thank you to Sarah and Kevin as well, who've supported us through this.
Thanks very much, Jo. And I'm getting some visual clues that is being echoed by other members of the governing body. Can I just reflect? I know Nick Ball is waiting to come in, but just reflect on that. Liz, and you may want to come back on this, but I think we just have to acknowledge, and having been to some of those meetings, it's clear that people do link the future of what they see as their hospital with their history in Tinmath with what we're proposing around services. And I think it would be good just to hear from you again. We talk that actually it's more about the services people get and the care people get. Can you just reiterate that commitment that we've got from you as a trust, that the services that people currently get benefit from in the coastal area will continue to happen within the coastal area, albeit on new sites? And so aside of bricks and mortar, and I understand the attachment to those, but aside from bricks and mortar, there will not be a detriment of service provision in that part of Devon. And the commitment to continue building that out of hospital, home-based service that a number of people, and particularly David earlier on, articulated so well.
Thank you, Paul. I appreciate the opportunity to reiterate for the governing body and our audience. This is a commitment to ensure that we continue to provide those services to people in their local community, that we continue to enhance the quality of those services, and that we see that as an opportunity to expand our community-facing offer in the future. And that is why we're proposing it. We believe the Health and Wellbeing Centre offers us an opportunity to build and give longevity to those services, ensuring that we've got the right environment to deliver the quality and type of care that we need now and into the future.
Okay, thank you. And Jo, I guess it's from the CCG executive. I guess I'm asking for an echo of commitment in the way that we commission that enables those services to continue in the way that we've promised within the consultation documents.
Yes, absolutely, Paul. So I think we've been committed to integrated services for a very long time now. This has been quite a long journey for us. So I think if we've got to go through the recommendations this afternoon. If we approve those recommendations, there's an absolute commitment from the CCG executive that we will follow through on that, and we'd want to build on that as well into the future. So not just for the coastal locality, but also across Devon as well. And it's really important that we reduce the variation in delivery we've got, reduce inequalities across Devon as county. So that's what we will be seeking to do moving forward from here.
Thanks very much, Jo. People still have questions to ask, and I am going to continue with those questions because I think it's important that we all ask what we need to ask. Nick Ball was next, but it does look as though you're saying his question has been dealt with, so that's fine. So Nick, put something in the chat if you still need to come in. But James.
Yes, thank you, Chair. It appears that a very constructive dialogue has been established with community groups, with patient groups, and with the voluntary sector, plus other stakeholders. I just wonder if there can be assurances that that dialogue will continue beyond the consultation process, so people will be kept informed of progress and any future decisions made.
Yeah, I'll start there. Sorry, I had some feedback. Sorry, I'll start there, James. And I might go to Liz, and actually Andrew might want to comment as well in terms, because actually we do a lot particularly to keep the public engaged with previous pieces of engagement consultation we've undertaken. And actually I think as a CCG we are very good at that. I think our commitment is, as a CCG, is to continue to work with the voluntary sector, community providers, and indeed we're doing that in several other pieces of work at the moment. So if I look at the community mental health framework transformation work we're undertaking at the moment, the voluntary sector, also communities are a huge part of that, and we're really considering how we work with them in a much more collaborative way, but also much more formal way in the future. So I think we know that's a really important part of how we want to commission services moving forward. I will hand over to Liz now, who just might want to comment from a trust perspective as well.
Absolutely. So I echo what Joe has said, and I think there is real opportunities to build on the success of the work that has been done. We've had it as a point of principle as we've developed the model of integrated care in the locality, to do that in partnership with people in our communities and our other partners, including the voluntary sector. And we have learned a huge amount as a consequence of that engagement, and we'd want to continue to do that. We've also looked to evaluate that, so to work with independent evaluation from the universities, who also get alongside the public to get an independent view, and we're really committed to continue with that as well.
Thank you very much. So James, that sounds like a fairly strong commitment. Yeah, okay. Charlotte.
Thanks. It might have been part answered by James's question actually, but specifically around people who are maybe caring informally or aren't paid carers, and I suppose their ongoing engagement, but also just to be assured that their engagement was sought as part of the process, given the link to the people they're caring for going in and out of formal care.
Yeah, good question. Thank you for that, Charlotte. I will just in terms of the detail of that, I'll probably go to Jenny and then ask if Alex just wants to comment.
Thanks, Joe. So I think it is really important, Charlotte, that we try and engage with all groups that find it difficult to get out and engage, and of course carers are one of those. So it was one of the questions that we asked in the consultation report. Actually, I'm one of the leads for carers in the CCG, so have really close links with our caring organisations, and I sit on the Carers Partnership for Devon. So it's making sure that we hear those voices consistently, especially when we're developing services.
Thank you. Sheila.
Thank you, Chair. So I'm not sure if this has been covered. I don't think so. Which is whether consideration has been given to, or an assessment rather being made of the impact of the parking difficulties and so on, which have been highlighted so many times on staff, and whether that's going to impact on productivity of staff. And I'm particularly thinking about the daily meetings of the community teams that Matt Fox told us about at the beginning of the presentation, because that could have a significant impact on numbers of patients that the community teams can physically go and see if they're not located in a suitably accessible place.
Yeah, thank you, Sheila. That's a good question. I'll start. I will pass over to Liz, who I'm sure will want to comment from her staff's perspective. So we have spoken to staff, and they have raised, as you quite rightly said, they have raised some concerns. So that is part of obviously the work we need to continue to do around public transport, etc. But also one of the recommendations we have within the report as well is a touch point potentially within Dawlish Hospital, which actually we think will be easier for them, particularly staff, as you say, who are in their cars going out to patients' own homes, having some sort of touchdown office space within Dawlish, which we think that will make it easier for individuals to do that. I don't know, Liz, whether you wanted to add anything to that.
Thank you, Joe, and you're right, Sheila. It's a really important issue to staff, and it's important that we work with them to resolve it. So there's three things I'd say. Firstly, is we're working very closely with the council to make sure that we provide optimum parking, so that we can look at all the options that are available, and we continue to look at solutions. The second comment would be, we talked earlier about the importance of digital in terms of access for patients. We know that that already is making a difference in terms of how staff are working and the pattern of staff working, that reduces the need for driving and parking. And the third issue, which I think Joe has already made reference to, is that we're looking at how we create touch points elsewhere, so that staff can make contact, have a computer to do some work in, and be able to access other support. So those are the three areas of focus for us. But you're right, it's an important issue.
Thank you. Thanks, Joe and Liz. I haven't got any other questions that have come up as requests. So Joe, what I'd like to do now, lots of people have asked lots of questions. I just want to help that you've got a series of questions on slides that I think will help focus our minds. I'd quite like to go through those, not for us to ask them verbally each time, but for each one of us to consider whether we are happy that we have heard enough, read enough, and had enough questions asked, that each of these questions we feel able to answer one way or the other. And then if we say yes to those, then I will move on to the specific recommendations.
Okay, that's great. So I'm just going to ask Steve to put the slides back up and start on the slide which has question number 1 on it. Great. So so as Paul said, so I think at this point it's really only, because I think we will have answered a lot of this, but this is really only if people have real concerns at this point. So the first question: is the governing body assured that the evidence and rationale is clear for the location of the high-use community clinics in the Health and Wellbeing Centre?
Just keep going through them, Joe, and I will just keep an eye on this.
Thank you. Okay, next slide, please. Okay. Is the governing body assured that the evidence and rationale is clear for the location of the specialist clinics, except ear, nose and throat and orthopaedics, into the Dawlish Community Hospital? Next slide, please, Steve. Is the governing body assured that the evidence and rationale is clear for the location of the ear, nose and throat and orthopaedics specialist clinics in the Health and Wellbeing Centre? Is the governing body assured that the evidence and rationale is clear for the location of the day case procedures in Dawlish Community Hospital? Is the governing body assured that the case for continuing with the community-based intermediate care and reversing the decision to have 12 rehabilitation beds in Tinmath Community Hospital has been robustly made? Is the governing body assured that all options were adequately reviewed and is in agreement with the decisions made by the steering group during the evaluation process? And is the governing body assured that the feedback from the consultation, including the suggestions from the public and the equality impact assessments, have been taken into account? And question 8, is the governing body assured that the CCG has met the gunning principles for public consultation? I won't go through the principles again.
Okay. Thanks very much. Thank you, Joe. So we've had no comments or questions raised in each of those, and so in which case I'm going to ask the voting members of the governing body, and just a reminder that James and Alison, your contributions to governing body are hugely valuable, but as associate non-executives, you are not part of the voting governing body. I'll have to ask you just to remain quiet during the voting process, if you don't mind. Thank you. So, of the voting members, are you comfortable with us taking all of the 8 recommendations together, including an addition to recommendation H, which needs to include that exploration around development of the voluntary patient transport that Graham helpfully suggested to us earlier? Again, please put any objections to that.
Sorry, give me the exact word. Give me the exact words for I think that'd be very useful. If we're going to vote on something, I think we should have the exact words. Could that come up on a slide or something?
For
I.
So what I would suggest. So there's H.
Graham's suggestion.
So Graham's suggestion, I would suggest being incorporated into H, because H is around transport.
Okay.
So that would be, it's not to incorporate not just around public transport and parking, around parking, but to explore alternatives to patients' own transport and public transport using the voluntary sector. Okay. Simon, can you please, you said not sure, can you expand on that for me, please?
I just wasn't sure that's all.
Sorry, say again?
I wasn't sure that I could say yes to all of them. I wasn't sure my response to all of them would be the same.
Right. Okay. Okay, in which case, let's go through each of them. So can I go through, what I'd like to do is, let me just have a look, 1, 2, 3, 4. So the first 5 are the consultation proposals. So can I take those together, because those are the elements that we consulted on. Yeah. Okay. So on the specific items that we went out to consultation on, which is items A, B, C, D, and E, can I please take a vote, and can I ask voting members to either put a Y for saying that they approve all of those elements, an N to say that they don't approve, or an A if they are abstaining, please. So I have got Simon Tapley is unable to vote on the screen, but I have got Simon Tapley on text saying yes. So I'm just, bear with me while I just go through numbers. I want to make sure that I do this properly. So I've got 1, 2, 4. Apologies, bear with me. 1, 2, 3. Okay, and Sheila, you have a question. Is that something you need to ask before you feel able to vote?
Yeah, it is. Sorry, Paul. I lost my hand for a few minutes there and my ability to type a question. So I just wondered about X-ray facilities and whether, if they are available at Dawlish, whether that would have an impact on the orthopaedic provision at the Health and Wellbeing Centre.
Yeah, so I think yes, we have gone through that actually, Sheila, because you're absolutely right in terms of needing to access. I know, Jenny, do you just want to give the detail of that?
Yeah, thanks, Joe. So that suggestion actually came from the staff, and I think there is X-ray at Dawlish, and people will be able to access that still, that direct access X-ray, which is 4 miles away. The reasons that they gave for wanting to have those clinics was to be able to work alongside GPs and the community physios in terms of that that treatment for those orthopedic issues, and they felt being able to discuss that with primary care and with the community physios prior to referral to orthopedics, and given them that access to those specialist orthopedics would give a more integrated service and was more important than them being able to access X-ray. Liz might want to come in on how she sees that working, but that was the feedback that we had as part of the consultation and that we took into account in the evaluation.
Okay, that's really helpful. Thanks, Jenny.
If you'd like me to comment, I just think we've got to work through the detail of making sure that that's an efficient pathway, but we have the option to do that in the way that's been set out in the recommendations.
Paul, you might be on mute.
No, I'm. My computer then stopped very briefly, but it is back on now. Okay, so Sheila has now voted, and that's fine. I'm going to make an assumption here that actually these decisions are reviewed, and as long as these services remain within the coastal area. But if the learning is that X-ray is more important once it's actually up and running, then I'm assuming that that would be the sensible thing to review those, as long as it didn't move away from either Dawlish or Tinmath. Okay, so in which case we have got 15 people who have voted in favour of these first 5 elements, and 1 person who has abstained. And so based on that, the governing body does approve recommendations A, B, C, D and E. Let's take recommendation F, which is to request Torbay and South Devon NHS Foundation Trust to consider in detail the suggestions put forward for additional services at the Health and Wellbeing Centre. And those are the additional services that were suggested as a result of the consultation. Again, I'm going to ask people to vote with the same letters in the chat, please. Okay, 1, 2, 3. So we have 16 have said yes, and no abstentions and no noes. So that we support that item as well. Item G, which is to request Torbay and South Devon NHS Foundation Trust consider providing secondary office space at Dawlish Community Hospital for physiotherapists, occupational therapists and district nurses. And I think that builds on the point earlier that was partly in response to Sheila's question around staff parking and staff access. So again, same approach then, please. And same again, I've got 16 yeses and no abstentions and no noes. So again, that gets carried. And then the third element, which is to request Torbay and South Devon NHS Foundation Trust work with Teignbridge District Council to mitigate parking issues for staff and patients as far as possible. And actually, we have discussed in there to mitigate parking issues inherent in that, and we will specify the wording for that. Will be to include within that exploring further development of the voluntary and patient transport service. So again, same approach, please. Again, 16, it is 16 now because Jerome's just come in, thank you. 16 yeses, no noes and no abstentions. So that means that the governing body do approve all these recommendations A through to H, with that addition to H. So I just want to say thank you to Joe, thank you to Jenny and Alex and the wider team for all your work on this. Thank you to the public for being an active part in this process, for being engaged in the consultation and beyond. Thank you to governing body for doing your job properly and thoroughly. And I know it's 10 past 5, but I think that reflects that you have done this well. And I think we have made a decision here that that is for the benefit of our population in that South Devon area. I look forward to seeing the teams coming together in the new Health and Wellbeing Hub, and that opportunity that comes with co-location and the ongoing development of the home support that is in place in the coastal region. Thank you all. I'm going to call an end to the governing body in public. I'm going to ask my governing body members just to stay on past the end of this live broadcast for a moment. Thank you, those members of the public who've been part of this. I do wish you a Merry Christmas and I would hope a more hopeful 2021. Thank you.